So we have FL, is a 51-year-old Musoga, a practicing Anglican who stays over the weekdays in Kampala and weekends in Iganga. And the next of kin is the wife. He's married with 4 children and qualified as an agriculturalist in 1993. So his concerning symptoms were extreme fatigue for 3 months and constipation for 2 months. And it all started in June of 2018 when he developed gradual but progressive fatigue following normal work routines for the past months. He reported slowness at accomplishing office work and activities of daily living. That was associated with excessive daytime sleepiness and forgetfulness, and he felt abnormally cold, more marked in the mornings and evenings, and difficulties in getting up from squatting or sitting position. However, he did not report any history of dizziness or lightheadedness after standing, and he had no issues with buttoning or combing of his hair. He did not report cough, shortness of breath on exertion, or paroxysmal nocturnal dyspnea. He did not report any history of orthopnea or chest pain. He did not report any associated muscle aches or muscle pain or joint stiffness. A month later, he developed constipation with occasional bouts of loose stool that was associated with loss of appetite, unintentional weight loss from 95 to 86 over a 2-month period, and also associated with generalized abdominal pain, but there was no distension. He did not report any history of blood or mucus in stool, and he reported normal stool color. There was no history of nausea or vomiting, and he did not report early satiety after meals. In the same month, he reported frequent urination during daytime and at night, and it was a large volume of dilute urine with a frequency of about 6 to 10 times during daytime and about 7 to 10 times in the night. He also reported history of polydipsia without polyphagia, no history of dysuria or flank pains. Around the same time, he also reported poor sexual performance with loss of libido, failure to sustain erection, and getting tired in a couple of minutes. Both the wife and the man, both of them were unsatisfied, and the wife was very unhappy. However, he did not report any loss of secondary sexual characteristics, no urination of semen after intercourse. But he noted a slight enlargement of both breasts. However, they were not painful and there was no discharge. He also reported low mood and irritability, reported depressed mood, and the wife complained of him being irritable during conversation. And he could sleep very late at night, about 11 p.m., and wake up very early at about 1 p.m. without falling back to sleep. And he reported some episodes of hearing voices instructing him, but that was occasionally. There was no associated history of suicidal ideation, leave that. He also reported darkening of the skin, of the face and limbs, swelling of the hands, fingers, feet and toes. That was also associated with numbness of both hands and pain at the wrist. However, he did not report any shin swelling. He did not report any history of headaches or blurring of vision, and there was no documented history of eye, ear, nose and throat infection or even meningeal infection. There was no change in voice and no anterior neck swelling. In his past medical history is only significant for a well-controlled systemic arterial hypertension that was diagnosed in 2017 and is on monotherapy of bisoprolol. He had Myers repair for his umbilical hernia in the early 70s, and there's a positive family history of sickle cell disease. The patient's perspective is that by then, when he first presented with darkening of the skin and weight loss, it was obvious to him that actually that was witchcraft sin. But with after seeing about 2 to 3 doctors, he got to realize that his problem was mainly with the endocrine system. And then it impaired his work and sexual dysfunction, as well as financial constraint because of the investigations that he invested in. But now he works normally. The main concern is that for how long will he swallow the medication he's on, and how will he raise the money required for operation? Is there any hope for use of herbal medicine? And his expectation is that at some point in time he hopes for the best and he thinks he will be okay. So in summary, I've presented a 51-year-old man with a past medical history of a well-controlled systemic hypertension who presented with a 3-month history of extreme fatigue, cold intolerance, constipation, neuropsychiatric events, sleepiness, polyuria and polyphagia, erectile dysfunction, and weight loss. He denied any history of headaches, blurring of vision, polyphagia, head injury, or previous diagnosis of meningitis or cerebrovascular accident. So his investigation, fasting blood sugar was normal, antibody screen for HIV was negative, and vitamin B12 was even above upper limit of normal. Hepatitis B surface antigen was negative, and without agglutination test was negative. We also investigated him for thyroid disease, and you can see the first test that was done in November showed a normal TSH, but a low free T4 and a low free T3 in those ranges. And you can also see in November, free T4 was still below lower limits of normal, but that free T3 was within normal limits because the patient was already on levothyroxine, and a thyroid stimulating hormone was within limits as well. And the rest of the tests done in December and January of 2019 as shown. We also did the C-reactive protein that was within normal limits. Prolactin was elevated at 47.4, and the upper limit of normal is 18.4. ACTH was within normal limit. Upper limit is 64.6, but the value we got was 16.6. And if you look at the serum cortisol level, was 37.2, which was again low. So then with all those manifestations, we had to request for a brain CT, which showed a macro adenoma of about 25.8 times 25.5 and 18.1, which confirms, demonstrate a pituitary mass, most likely a macroadenoma of the pituitary. So with that, we also requested for a visual field test, and you can see this is for the left eye and this is for the right eye, and the visual field is clear in both eyes except for obviously the blind spots, which are on both sides, and the visual field index was very good in both eyes, with 99% on the left and 99% on the eye, on the right eye. That means it is very near to 100%, which is what we expect for normal population. And the mean deviation as well is just negative 8.8, which is 1.8, which is very good. So our final diagnosis for this patient is that we have a case of pan-hypopituitarism, secondary to a pituitary macroadenoma with predominance of hypothyroidism, central diabetes insipidus, and hypogonadism without any visual field defects. And the current medication the patient is on, levothyroxine, prednisolone, and bisoprolol for his high blood pressure. Thank you.